Welcome once again to Channel 18, and these two young ladies beside me represent the Ellen Jones Dental Medical Center, which is at Cape Tech College. No, yeah, that's a high school. High school, right up here in Harwich. And Judith Reppucci, to my immediate right, is the general manager, and Jane Poranski is the head of internal services there. So we're going to start with Jane. Jane, what do you mean by internal services?
Well, I'm the senior patient access representative, so I am in charge of all the front desk operations. We run the scheduling for all of the providers and making sure that all the patients get in at the right times.
Oh, do you have a lot of patients?
We do. We have a lot of patients. We have a full schedule of patients. We work Mondays and Fridays. We're there from 8 to 4, and Tuesday through Thursday we're there 8 to 8.
Wow.
We see patients throughout that whole time.
And what, you do all kinds of work?
We have general dentistry, we do some endodontics, and we have an oral surgeon that works for us as well.
An oral surgeon, wow.
Yes.
And so you could pull teeth and make new ones?
Yes, yep.
Wow. Okay.
Yep.
And what is it that you do, Judith?
So I am the marketing liaison for Cape Cod. I work for Harbor Health Services, which is the umbrella organization for both Ellen Jones here in Harwich and Harbor Community Health Center in Hyannis.
Wow.
We're celebrating our 50th year. Community Health Center movement started 50 years ago with our clinic in Dorchester, which we still run nowadays.
You've been around for a while.
We have. We're very proud to be part of the public health movement in this country. It was started because it was thought that everyone in the community should have access to affordable health care no matter what your ability to pay. And that's the reason that a group of grassroots citizens got together in Harwich and started Ellen Jones Community Dental Center.
How long has that been in operation now?
Ellen Jones at the high school is about 17 years old now.
It's interesting because back when I was early here, there was a young man that needed some dental work, and we had to contribute something because, you know, he's a young kid and he had a lot of problems, and the fellow that was promoting him for a dentist, said he just needed the dental work. He didn't know about that, I guess.
Well, I think that's one reason we're so grateful that you're having us here today. It gets the word out to everyone that Ellen Jones is here for you, whether you're employed and you have insurance but you don't have dental insurance, whether you own your own business and you don't have insurance. We really want seniors especially to know, because Medicare doesn't cover dental, that you can come to us. We accept all forms of health insurance. We accept Blue Cross Blue Shield, everything else. We accept most minor health insurances, but we also accept Mass Health. So we're also the place where a lot of people turn when they need a provider who accepts that.
Yes. And all of these patients, they all make all of their appointments, do they, Jane?
Most of them have scheduled appointments. We also accept emergencies on a walk-in basis. So if you're having any type of dental emergency, you can just walk in and you'll be seen that day. There might be a waiting period like the emergency room, but we will see them as soon as we can.
That's pretty good.
It's great.
You can go for an emergency like that.
Definitely.
Wow. And you have someone there who pulls teeth?
We do, yep. We have the oral surgeon, Dr. Gill. He's at the Ellen Jones office on Tuesdays, Thursdays, and Fridays. The other days he's in our Hyannis office.
Wow. Now, are they're all salaried dentists, or do they get per diem work?
Nope, they're all on salary.
They're all on salary. Yep. Very good. And so that's pretty good.
Yeah.
And you have anything to add to your marketing story?
Well, I can tell you the story about how how we started.
Well, that'd be good.
We were started by a couple of young doctors in Dorchester. They had been active with Doctors for Social Responsibility. One of them had gone to South Africa, and he came back to the United States and said, you know, they have a model over there where there's a health center right in the community to help everyone, and we need that here. So in Dorchester, back in the days when there was a great deal of need on Columbia Point, he opened up the country's very first community health center. And we're now the first of 1,200 community health centers in the country. So we're very proud of that. We came down to the Cape to assist Ellen Jones to get on its feet. And we also worked with what was then called the Mid and Upper Cape Community Health Center in downtown Hyannis. And both of them asked to come under the Harbor umbrella. Mid and Upper Cape Community Health Center is now called Harbor Community Health Center Hyannis. And last year we moved to a beautiful new facility in the industrial park in Hyannis across from Home Depot. We're on Addicks Lane there. So, and we're of course continuing at Ellen Jones, and we're very happy that we just received a grant this spring so that we can build a wheelchair ramp for access. Right now there's access through the high school.
Yes.
But that precludes us being open on Saturdays when the high school is closed. So once we get the wheelchair ramp, we'll be expanding the hours for the weekend.
Now, does the school educate any of the people there to be healthcare providers?
Yes.
They have
yes.
a dental assisting program. They
They
have
do.
both the high school students, and they have a night program for dental assisting. And all of the students will come in and observe and get some clinical hours on dental assisting.
Okay. And do you hire some of those people?
Yes, we have one girl that's one of our dental assistants who was hired that graduated last year from the program.
Oh, very
Yeah.
good. Now, when you were talking about the development of this program, the funds to run it come from various sources now. But back then, were there as many sources?
There were not. We are partially federally funded, so we come under federal guidelines as far as being overseen, and they're pretty stringent, but it's the mode of operation that the Affordable Care Act really was modeled on, because we're economically very lean and mean. So
They don't pay you, right?
oh. We love our jobs.
We do.
And that's the thing with a lot of people who work in community health. We're very mission driven, and I think our wonderful dentists and dental hygienists and dental assistants all feel that sense of purpose to helping people in the community.
Yes,
That's
absolutely.
very good. The both of you definitely have that. Yeah.
Thank you.
Well,
And there's just one other thing I wanted to share
Well, go
with
right ahead.
people in Harwich, and that's that our belief is that we don't turn anyone away, and that comes from our CEO on down. So somehow, some way, we will make it work for people, no matter what your financial circumstances may be. However, if you do just want to come into to either Harbor Community Health Center in Hyannis or to Ellen Jones in Harwich, and you want to pay out of pocket, so to speak, you can do that. And one really nice tip is that if you pay on the day of service, the charges are half price.
wow, that's a good deal.
So I think Jane can give an example.
Yeah. So the initial visit, what they would come in for would be an exam and x-rays, where the doctor would, find any issues that they would need to diagnose, anything that they would need to come in for. That initial visit is regularly $261. It would be half price. And then for cleanings, you get those twice a year, and that's $107. So it would be $53.50 half price for a cleaning.
So your prices are not terribly different from the regular dentists, are they?
They're pretty different. A normal cleaning at a private practice would be around $200. Ours are $107 and then 50% off.
Okay. Maybe my dentist is is a little more lenient. So, well,
and one other tip is that because of the population we serve, we have a number of people who might cancel appointments.
oh yes, you
Yes.
mentioned that.
So right now, for new patients, how far out are we scheduling, Jane?
I think we're booking in June right now for new patients, and some people get a little upset about that, but what we suggest is that if you can't get an appointment till June, don't feel discouraged that you're not going to get in until then. You can call every day and check on cancellations. We get cancellations every day. Usually they're first thing in the morning when we get in, and we'll listen to the machine and we'll get all of the messages. So they can just give us a call and we can get them in as soon as possible.
For example, this morning,
Yeah, we had a few cancellations this morning.
Is that right? Wow.
Yeah.
Why do people cancel?
For various reasons, family emergencies, sickness, lack of insurance and issues like that.
I don't understand lack of insurance. They're making
Sometimes
the
they have
appointment.
issues with their insurance, so they don't want to pay for the services that day, or they don't know that we offer the 50%, so they'll just cancel. And we try to discourage them from canceling. We try to get them in as much as we can.
So one requirement then would be you would have to have your insurance updated.
It's not a requirement. We
It's
don't
not
require any
required.
insurance. Anybody can come even if they don't have insurance.
Okay. And if they don't, and if they can't pay,
They don't have to pay that day. We offer the 50% off that day if they want to pay, but if they don't want to pay that day or they can't afford it, they'll just get a bill from us, but it will be for the full price.
I see.
But we don't require that anybody pays that day if they can't pay.
Okay. Well, you've given us a little understanding of what the Ellen Jones Dental Society is all about, and we want to thank you for that. And we hope that those of you who are listening and have a toothache and don't have a dentist will call Ellen Jones and speak to one of these two ladies and make your appointment. So thank you again for joining us today, and we appreciate all that you've had to say.
it's been a pleasure. Thank you for having us.
Thank you.
Not at all.